Hey folks, welcome back to Legacy of Old Age. What if a trip to the doctor left your wallet empty just when you needed care the most? For us old-timers, healthcare costs can feel like a mountain too steep to climb, but it doesn't have to be that way, not if you know the right secrets. Cheap healthcare for seniors, every senior should know. Today, we're diving into a topic that's as vital as a good pair of boots, with stories that'll tug at your heart, open your eyes, and maybe even save you a pretty penny. Stick with me, because I've got tales that'll warm your soul, ease your worries, and give you a few tricks from the old days with a modern twist to keep you healthy without breaking the bank. In the miles ahead, you'll hear about a sweet widow who couldn't afford the care she needed, a proud farmer who learned the hard way about insurance, a spunky gal who found clever ways to save, and a straight talk from my own pop that showed me how to stay healthy on a budget. So grab a cup of coffee or whatever you sip back when doctor visits cost a nickel and settle in, folks. This road's got some turns worth taking. It all started a few summers back when I stopped by Mrs. Mabel's place down in Tennessee. She lived in a little clapboard house off a dirt road, the kind with a sagging porch and a garden out back that'd make your mouth water, tomatoes red as a barn, beans climbing high on their poles. Mabel was 82, with a laugh that'd warm you up faster than a July sun, and a knack for baking pies that'd win any county fair. I'd known her for years. She'd been a school teacher, raised 3 kids on her own after her husband passed, and always had a kind word for everyone. But that summer, when I knocked on her screen door with a jar of my mama's peach preserves, I found her sitting on her porch, her hands trembling, her face pale as a ghost. "Mabel," I said, setting the jar down on her checkered tablecloth, "you don't look right. You feeling okay?" The air smelled of cinnamon and dust, and her old tabby cat, Whiskers, was curled up at her feet, purring softly. She didn't look at me, just kept her eyes on the garden, and whispered, "I can't afford to find out." I pulled up a chair, my stomach twisting, and she told me her story. Mabel had been feeling off for weeks, a cough that wouldn't quit, a pain in her chest that came and went, and a tiredness that dragged her down. "I wanted to see the doc," she said, her voice cracking like dry leaves, "but the visit's $50, and the tests are more. I'm on a fixed income. My pension barely covers the bills. I can't afford to be sick, so I just wait." I sat there, folks, feeling my heart sink like a stone in a well. Mabel was too scared to get the care she needed because she couldn't afford it, and that cough, that pain, they weren't just nothing. I wasn't about to let her wait any longer. I called her daughter Mary right then and there, and we got Mabel to a free clinic in town the next day. The doc listened to her chest, ordered a cheap x-ray through a community program, and found a bad case of pneumonia treatable. Thank the stars. But it could have turned deadly if she'd waited much longer. Mabel got her meds through a discount program, and last I heard, she's back to baking pies, her laugh as bright as ever. But it was a close call, folks, one that could have gone the other way if she hadn't found a way to get care on the cheap. Ever known someone who couldn't afford the care they needed, folks? Or maybe you've had to stretch $1 to cover a doctor's bill. Drop it in the comments. I'd love to hear your stories. That day with Mabel got me thinking about how hard it can be for us old-timers to afford health care, especially on a fixed income, and how many of us let our health slip because of it. I started digging, and the experts say there's ways to get care on the cheap, from free clinics to discount programs, even government help like Medicare, if you know where to look. Back in the day, we'd say a good neighbor helps in a pinch. And now, the experts say start by checking your local community center. They often have info on free or low-cost clinics, the first step to getting care without breaking the bank. Mabel's scare was just the beginning, and it set me on a path to learn more about the secrets that can keep us healthy on a budget. Mabel's close call stuck with me, like the smell of her cinnamon kitchen. Folks, that image of her sitting on her porch, too scared to see a doctor because she couldn't afford it, kept playing in my mind like an old record on repeat. It got me wondering how many other old-timers were skipping the care they needed. Not because they didn't want it, but because the cost was just too steep. I'd seen Mabel get lucky with a free clinic, but I knew not everyone would. And it wasn't long before I heard about Mr. Hank down in Georgia, a proud man who learned the hard way about the power of insurance, teaching me a lesson about getting help that I'll never forget. Hank lived on a small farm just outside Macon, the kind of place where the air smells of hay and honeysuckle, and the fields stretch out like a patchwork quilt under the summer sun. He was 76, built like a barn door, even after all those years, with a laugh that'd shake the leaves off a tree. Hank had been a farmer his whole life, raised hogs, grew peanuts, and could fix a tractor blindfolded with nothing but a wrench and a prayer. He was a regular at the local diner, always at the counter with a cup of black coffee, swapping stories with the other old-timers about the good old days. But that spring, when I stopped by his place to drop off a sack of pecans I'd picked up for him, he loved them in his pies, I found him sitting in his kitchen, staring at a stack of medical bills with a look of defeat I'd never seen before. "Hank," I said, setting the pecans down on the counter, "you look like you've lost your best hog. What's wrong?" The air smelled of coffee and linseed oil, and his old hound, Rusty, was snoring in the corner like a freight train. He didn't look at me, just pushed the bills across the table and said, "I can't pay these." I pulled up a chair, my stomach twisting, and he told me his story. A few months back, Hank had a bad fall, slipped on some wet hay, and broke his hip. He'd needed surgery, a hospital stay, and weeks of physical therapy, but he didn't have insurance to cover it. "I never signed up for Medicare," he said, his voice low. "Thought I wouldn't need it. I've always been healthy. Figured I'd save the money. But the hospital bill's over $10,000, and I don't have it. I might have to sell the farm to cover it." I sat there, folks, feeling a lump in my throat the size of a peach pit. Hank told me how he'd always prided himself on being self-reliant. He'd never taken a handout, never needed help, until that fall turned his world upside down. "I didn't know about Medicare," he said, his big hands trembling as he gripped his coffee mug. "Didn't know it could have covered most of this, the surgery, the therapy, even some of the meds. Now I'm stuck, and I don't know how I'm going to make it." I looked at Hank, his eyes full of regret, and knew I had to help. I called a friend who worked at the local Social Security office, and we got Hank enrolled in Medicare Part A and B right away. It didn't erase the bill, but it helped him negotiate a payment plan, and it'll cover most of his care going forward. Last I heard, he's keeping the farm, but it was a hard lesson, folks, one that could have been avoided if he'd known sooner. Ever known someone who struggled to pay a medical bill, folks? Or maybe you've had a scare with your own healthcare costs. Drop it in the comments. I'd love to hear your stories. That day with Hank broke my heart, but it lit a fire in me to learn more about how us old-timers can get care on the cheap, especially when a big bill can turn your life upside down. I started digging, and the experts say one of the best secrets to cheap healthcare is knowing your insurance options. Like Medicare, which most of us qualify for at 65. They say Medicare Part A covers hospital stays, Part B covers doctor visits and tests, and you can add Part D for prescriptions, all for a small monthly premium if you sign up on time. There's a trick from the old days with a modern spin to help us through. Back when I was a kid, we'd say a good farmer plans for the lean years. And now the experts say plan for your health care costs, sign up for Medicare when you turn 65. And if you're late, don't wait, because the penalties can add up. They say to call your local Social Security office or check online at medicare.gov to see what you qualify for. And if you're on a tight budget, look into Medicaid. Too, it can help cover what Medicare doesn't, especially if your income's low. Hank's lesson wasn't the end of what I'd learn, and it got me wondering how others found their way to keep their health care costs down without missing out on the care they need. Hank's hard lesson left a heavy weight on my chest, folks, like a sack of feed I couldn't put down. His struggle to pay that hospital bill after skipping Medicare kept echoing in my mind. It got me wondering how others found their way to keep their health care costs down without missing out on the care they need. Those doctor visits and meds that keep us going in our golden years. I'd seen Mabel get lucky with a free clinic, watched Hank pay the price for not having insurance, and I couldn't help but hope there was a brighter side to this tale, a story of someone who'd learned the secrets to saving on health care without sacrificing their health. That's when I heard about Miss Betty, a spunky gal from Alabama who found clever ways to keep her costs low, showing me that a little know-how can go a long way. Miss Betty lived in a tidy little bungalow on the edge of Montgomery, the kind of place where the front yard's always blooming with azaleas. And the mailboxes painted with sunflowers she did herself. She was 74, with a laugh like a wind chime, and a knack for knitting scarves so soft you'd swear they were made of clouds. Betty was a firecracker. She'd been a nurse during the Korean War, raised 4 boys on her own, and could still outdance anyone at the church social, even with her bad hip. I'd known her for years, always seeing her at the county fair with her famous lemon squares, the kind that'd make your mouth pucker and your heart sing. That fall, when I stopped by her booth to pick up a square, I could tell she was in high spirits. Her eyes sparkled like the morning dew, and she had a grin that wouldn't quit. "Betty," I said, brushing crumbs off my shirt, "you're looking fit as a fiddle. How are you keeping up with the doctor bills?" She laughed, bright as a bell, and motioned me to sit on a bench nearby, the air thick with the smell of cotton candy and hay. "I've got my ways," she said, her voice full of pride. "Found some tricks to keep my health care cheap without skimping on care." I leaned in, curious as a cat, and she told me her story. Betty had her share of health troubles: arthritis in her knees, high blood pressure, and a touch of diabetes, but she'd learned how to manage them without breaking the bank. "I can't afford to spend a fortune," she said, her eyes twinkling, "but I ain't about to let my health slide either." Betty shared her secrets, and I listened like they were gold. First, she'd found a pharmacy that offered generic drugs, the same meds as the name brands, but a fraction of the cost. "My blood pressure pills used to cost me $50 a month," she said, winking. "Now I get M for 10 at the discount pharmacy down the road." She'd also started using a free app to compare prices on her meds, finding the cheapest ones at places like Walmart or even online. For doctor visits, Betty went to a community health center that charged on a sliding scale. They looked at her income and only charged what she could afford, sometimes as little as $20 a visit. "And I don't buy what I don't need," she added, grinning. "I ask my doc if every test is necessary. Sometimes they'll say no, and that saves me a bundle." I sat there, folks, the sound of the fair buzzing around us, and felt a grin spread across my face. Betty had found ways to keep her health care cheap, and she was healthier than ever for it. Ever known someone who found a clever way to save on healthcare, folks? Or maybe you've got a trick for keeping your doctor bills low. Drop it in the comments. I'd love to hear your stories. That day with Betty taught me a trick from the old days with a modern spin. Back when I was a kid, we'd say, don't buy what you don't need. And now the experts say, ask your doctor if every test or med is necessary. If there's a cheaper option, like generics, take it. And look for pharmacies that offer discounts, like Walmart or Goodrx. They say you can also use apps to compare prices, and community health centers often charge based on what you can afford. Just call and ask. Betty's clever saving wasn't just about the money, it was about the peace of mind it gave her, knowing she could stay healthy without emptying her wallet. The experts say that's the real secret to cheap healthcare in our golden years, finding ways to get the care you need without paying more than you have to, so you can focus on living, not worrying. Betty's story got me thinking about how we can all learn to save smarter, and it wasn't long before I got some straight talk from someone closer to home about keeping our healthcare costs down for the long haul. Betty's clever tricks warmed my heart like a sunny day in spring. Folks, seeing her keep her healthcare costs low with generics and community clinics showed me that a little know-how can go a long way in our golden years. But it got me thinking about how we can keep those costs down for the long haul. Not just with meds and visits, but by staying healthy so we don't need as much care in the first place. I'd seen Mabel struggle to afford a doctor, watched Hank pay the price for skipping insurance, and learned from Betty's smart saving, but I still didn't have the full picture. The kind of straight talk that'd help us old-timers stay healthy on a budget. That's when I turned to my own pop, a man who'd been wrestling with his own worries about healthcare costs, and a talk with a health expert that gave me the secrets to keeping our bodies strong without breaking the bank. Pop lived in that same little house outside Springfield, Missouri, where the blackberry bushes still grew wild, and the porch creaked under every step. He was 83, with a voice that growled like an old diesel engine, and a laugh that'd make you forget your troubles. Pop had always been a big man round as a barrel, with a belly that had earned him the nickname, Big Hank, down at the diner, but he'd never been one to fuss about his health. That is, until a few months back, when I found him on the porch one evening, rocking in his chair with a mug of coffee in hand, the air smelling of wood smoke and the last of the summer flowers. "I'm worried," he said, his brow furrowed deeper than a plowed field. "My knees are acting up, and my blood pressure's high again. Doc says I need more meds, maybe some tests. But I can't keep paying these bills. How am I gonna afford it all?" I sat there, folks, feeling a pang in my chest. Pop had always been the strongest man I knew, and hearing him worry about healthcare costs cut me deep. I'd promised Mabel, Hank, and Betty I'd find answers, and now I had to keep that promise for Pop too. I called up a health expert I knew, a nurse named Linda who'd been helping folks in Springfield for years, and set up a meeting at the community center. Linda was a warm woman, 60, with a smile that put you at ease and a notebook full of tips she'd gathered over the years. When we sat down in a quiet room, the smell of fresh coffee in the air, I got right to the point. "Linda," I said, "Pop's worried about his health care costs. How can we keep him healthy without spending a fortune?" Linda smiled, nodding like she'd heard this question 1,000 times. "The best way to save on health care," she said, her voice steady as a preacher's, "is to keep yourself healthy so you don't need as much care." She told us the key is prevention, taking care of your body now so you don't need expensive treatments later. "Start with the basics," she said, ticking off on her fingers. "Eat right, lots of greens, fruits, and whole grains. Not too much sugar or salt. It keeps your blood pressure down, your heart strong, and your diabetes in check, so you don't need as many meds. She told Pop to move a little every day, even a short walk around the farm, maybe 30 minutes, can keep his joints loose and his heart pumping, cutting down on doctor visits. And don't skip your checkups, she added, but ask for free ones. Lots of clinics offer free blood pressure or diabetes screenings, especially during health fairs. Linda also gave us a secret for when you do need care. Use telehealth. You don't always need to go to the doc's office, she said, pulling out her phone. Lots of doctors now do visits over the phone or video. It's cheaper, sometimes even free with Medicare, and you don't have to pay for gas to get there. Pop nodded, his shoulders relaxing for the first time all day, and said, "Guess I'll start walking to the diner instead of driving. Might save on gas and doctor bills." I couldn't help but laugh. Folks, that was Pop, always finding a way to keep his spirits high. But Linda's words stuck with me, and I started digging deeper into what the experts say. They say prevention is the cheapest healthcare. Things like eating a balanced diet, staying active, and getting free screenings can keep you out of the hospital, saving you thousands in the long run. Ever found a way to stay healthy on the cheap, folks? Or maybe you've got a trick for cutting down on doctor bills. Drop it in the comments. I'd love to hear your take. That day with Linda taught me a trick from the old days with a modern spin. Back when I was a kid, we'd say an apple a day keeps the doctor away. And now the experts say eat your greens, move a little, and use telehealth to keep your costs low. It's the best way to stay healthy without spending a fortune. Pop's relief wasn't the end of what I'd learned, and it got me thinking about how we can all put these secrets together to keep our healthcare cheap for the long haul. Linda's straight talk in that community center was like a warm quilt on a chilly night, folks. It wrapped me up in the know-how to keep our healthcare costs low without missing out on the care we need. I'd seen Mabel nearly let her health slip because she couldn't afford a doctor, watched Hank struggle with a hospital bill he didn't see coming, learned from Betty's clever tricks to save on meds, and sat with Pop as he worried about his own bills, only to find relief in simple prevention. Each story added a piece to the puzzle, and by the time I walked out of that center, the sun dipping low over Springfield, I knew the truth. Cheap health care for seniors, every senior should know. It's not just about saving a buck. It's about keeping your health and your peace of mind so you can enjoy your golden years without worry. Let's roll it back and look at the road we've traveled, folks. There's Mabel, sweet as her Tennessee tomatoes, trembling on her porch with a cough she couldn't afford to check, nearly losing her chance at treatment until a free clinic stepped in. I can still hear that dry, hacking cough, the way she whispered she couldn't pay until we got her the care she needed. Then Hank, out by his Georgia barn, his big hands trembling over a stack of hospital bills, stuck with a $10,000 debt because he didn't know about Medicare. I'll never forget the regret in his eyes, the way he stared at those bills like they held his whole future. Miss Betty, spunky as ever, finding her way to cheap care in Alabama, saving a bundle with generics and community clinics. I can still hear her laugh, bright as a wind chime, as she shared her secrets at the county fair. And Pop, my own big Hank, sitting on his Springfield porch with a coffee in hand, worried about his rising healthcare costs, but learning from Linda how to stay healthy on the cheap. I can still see his grin as he said, "Guess I'll start walking to the diner," a weight lifting off his shoulders. They're all different, ain't they? Mabel's a widow with a heart of gold. Hank's a farmer who prided himself on self-reliance. Betty's a firecracker who danced circles around us all. and Pop's a stubborn old cuss who'd rather eat pie than worry about his health. But they've all taught me one thing: healthcare costs don't have to break us. Not if we know the secrets to keeping them low, so we can focus on living, not paying. I got to thinking, if they can find these ways, so can we. And I'll be darned if I don't share what I've learned to help every senior out there keep their healthcare cheap for the long haul. So let's round up some tricks from the old days with a modern twist to keep our healthcare costs down, folks. First off, know where to get care on the cheap. Back when I was a kid, we'd say a good neighbor helps in a pinch, and now the experts say check your local community center for free or low-cost clinics, where you can get checkups, screenings, or even meds for a fraction of the cost. They say to look for programs like Medicare's free wellness visits. If you're on Medicare, you can get a yearly checkup at no cost, just to catch trouble early. And if your income's low, check into Medicaid. It can help cover what Medicare doesn't, like some meds or long-term care, so you're not stuck with a big bill. Second, save on the care you need, like Betty did. Back in the day, we'd say, don't buy what you don't need. And now the experts say, ask your doctor if every test or med is necessary. If there's a cheaper option, like generics, take it, and use apps like GoodRx to compare prices at pharmacies, where you might get your pills for half the cost. They say to look for discount programs. Two places like Walmart or Costco often have low-cost meds, and some clinics charge on a sliding scale, so you only pay what you can afford. And if you don't need to see the doc in person, try telehealth. A video call can be cheaper, sometimes even free with Medicare, and it saves you the gas money to get there. And here's the best trick of all. Folks, stay healthy, so you don't need as much care. Pop's talk with Linda showed me how prevention can save a fortune. Back when I was young, we'd say an apple a day keeps the doctor away. And now the experts say eat your greens, move a little, and get free screenings. Lots of clinics offer free blood pressure or diabetes checks, especially during health fairs, so you can catch trouble before it gets expensive. They say to eat a balanced diet, lots of fruits, veggies, and whole grains, not too much sugar or salt, and walk 30 minutes a day, even if it's just around the farm, to keep your heart strong and your joints loose. The less you need the doc, the less you'll spend, and that's the cheapest healthcare of all. What's your trick for keeping healthcare costs low, folks? Ever found a secret that helped you stay healthy on a budget? Drop it in the comments. Your stories are the gold here, and they might just help someone else. Hit that like button if these tales hit home. Smash subscribe and ring the bell, so you don't miss what's next. There's more wisdom waiting just around the bend. Share this with a friend who'd get a kick out of it. Let's keep the conversation going and keep our health in check. I've got more stories to share, so stick with me. We're not done yet.